Question 1. Quality control measures reveal that a CI8 candidate's proposed educational module on the evolution of yoga therapy presents a narrative that is overly focused on a single historical period and neglects significant subsequent developments and adaptations. Which of the following approaches to revising this module would best align with the professional standards and ethical guidelines expected of a certified yoga therapist? Option A. Highlight the parallels between the evolution of yoga and the development of Western psychological and medical practices, suggesting a direct lineage and convergence. Option B. Focus exclusively on the earliest scriptural references to yogic practices, presenting them as the definitive and unchanging foundation of all subsequent yoga therapy. Option C. Prioritize the most recent Western interpretations and commercialized forms of yoga, framing them as the pinnacle of yoga therapy's historical progression. Option D. Emphasize the integration of yogic principles into contemporary health and wellness models, acknowledging the diverse philosophical and practical influences that have shaped yoga therapy over millennia, from its ancient roots to modern applications. Correct answer is D. Emphasize the integration of yogic principles into contemporary health and wellness models, acknowledging the diverse philosophical and practical influences that have shaped yoga therapy over millennia, from its ancient roots to modern applications. Explanation. Scenario analysis. This scenario presents a professional challenge for a CI8 candidate who is developing educational materials. The challenge lies in accurately representing the historical evolution of yoga therapy without misinterpreting or oversimplifying its complex development. The CI8 credential signifies a commitment to evidence-based practice and ethical conduct, which includes providing accurate and nuanced information to clients and the public. Misrepresenting the historical trajectory of yoga therapy could lead to a misunderstanding of its therapeutic applications, its philosophical underpinnings, and its distinction from purely spiritual or physical practices. This requires careful judgment to ensure that the historical narrative is both informative and ethically sound, respecting the diverse origins and transformations of yoga. Correct approach analysis. The correct approach demonstrates an understanding that yoga therapy's evolution is not a linear progression, but a multifaceted development influenced by various philosophical schools, cultural contexts, and therapeutic adaptations over millennia. It acknowledges the integration of yogic principles and practices into Western medical and psychological frameworks, while also respecting its ancient roots. This approach aligns with the CI8 emphasis on a comprehensive and informed understanding of yoga therapy, promoting a practice that is grounded in both tradition and contemporary evidence. It avoids anachronisms and respects the distinct historical periods and influences that have shaped yoga therapy into its current form. Incorrect approach is analysis, an approach that focuses solely on the earliest Vedic texts and ignores subsequent developments and adaptations, fails to acknowledge the evolution of yoga into a therapeutic modality. This is an ethical failure as it presents an incomplete and potentially misleading historical account, neglecting the significant contributions of various philosophical traditions and modern therapeutic applications that are integral to contemporary yoga therapy. It also fails to meet the CI8 expectation of understanding yoga therapy's multifaceted nature. An approach that exclusively highlights modern, westernized interpretations of yoga, disregarding its ancient philosophical and spiritual origins, is also ethically problematic. This presents a superficial understanding of yoga therapy's lineage and can lead to a practice that is disconnected from its foundational principles. It misrepresents the depth and breadth of yoga's evolution and fails to provide a holistic perspective, which is crucial for a CI8. An approach that conflates the evolution of yoga with the evolution of Western psychotherapy without clearly delineating the distinct historical trajectories and influences is an oversimplification. While there are areas of overlap and integration, yoga therapy has its own independent historical development. This approach risks diluting the unique identity of yoga therapy and misrepresenting its historical journey, which is an ethical concern regarding accuracy and clarity in educational content. Professional reasoning. Professionals in yoga therapy should approach historical narratives with a commitment to accuracy and nuance. This involves consulting a range of scholarly sources, understanding different historical periods and their contributions, and recognizing that evolution is often a complex interplay of continuity and change. When developing educational materials, It is crucial to present a balanced perspective that honors the ancient origins while acknowledging the modern adaptations and therapeutic applications. This ensures that clients and the public receive accurate information, fostering trust and upholding the integrity of the profession. The decision-making process should prioritize a comprehensive and ethically sound representation of yoga therapy's historical journey. Question 2. Process analysis reveals a client with a history of degenerative joint disease in their knees and hips expresses a strong desire to perform a specific sequence of deep hip flexion and knee bending poses during their yoga therapy sessions, believing it will improve their joint mobility. The yoga therapist has concerns that these specific movements, as described by the client, may place excessive stress on the client's compromised joints, potentially leading to increased pain or further damage. What is the most appropriate course of action for the yoga therapist to take? Option A. Advise the client to seek a second opinion from a medical doctor before proceeding with any yoga therapy and postpone the session until a medical clearance is provided for the specific poses. Option B. Conduct a thorough biomechanical assessment of the client's knee and hip joints. Evaluate the specific movements requested in the context of their condition, and collaboratively discuss safe modifications or alternative poses that address the client's goals without compromising joint integrity. Option C. Refuse to incorporate the requested poses, explaining that they are too risky for the client's condition, and proceed with a standard therapeutic yoga sequence without further discussion of modifications. Option D. Immediately implement the client's requested sequence of poses, trusting their intuition about what feels beneficial, and closely monitor for any signs of distress during the session. The correct answer is B. Conduct a thorough biomechanical assessment of the client's knee and hip joints, evaluate the specific movements requested in the context of their condition, and collaboratively discuss safe modifications or alternative poses that address the client's goals without compromising joint integrity. Explanation. This scenario presents a professionally challenging situation because it requires the yoga therapist to balance the client's stated desire for a specific therapeutic approach with their own professional judgment regarding the safety and efficacy of that approach, particularly when it involves a significant musculoskeletal condition. The challenge lies in respecting client autonomy while upholding the ethical responsibility to do no harm and adhere to the scope of practice as defined by the IAYT standards. The therapist must assess the client's condition, understand the potential risks and benefits of the proposed modifications, and communicate this assessment clearly and compassionately. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment and a collaborative decision-making process. This aligns with the IAYT emphasis on evidence-informed practice, client-centered care, and the ethical imperative to practice within one's competence. By conducting a comprehensive assessment of the client's specific joint limitations, muscle imbalances, and pain patterns, the therapist can determine the most appropriate and safe modifications. This approach ensures that the therapeutic interventions are tailored to the client's unique needs and that potential contraindications are identified and addressed, thereby minimizing the risk of exacerbating the condition or causing further injury. This is a direct reflection of the IAYT commitment to professional standards and client well-being. An incorrect approach that involves immediately implementing the client's requested modifications without a thorough assessment would be a significant regulatory and ethical failure. This would violate the principle of do no harm by potentially exposing the client to movements that could worsen their joint instability or muscle strain. It also demonstrates a lack of professional competence and a failure to adhere to the IAYT standards for individualized assessment and treatment planning. Furthermore, blindly following a client's request without professional evaluation could be construed as practicing outside the scope of yoga therapy, as it bypasses the necessary clinical reasoning and risk-benefit analysis. Another incorrect approach, that of dismissing the client's request outright and refusing to explore any modifications, would also be ethically problematic. While safety is paramount, a rigid refusal can undermine the therapeutic alliance and disregard the client's agency in their healing process. This approach fails to engage in a collaborative dialogue and explore potential safe alternatives, which is a core component of client-centered care. It also risks alienating the client and preventing them from receiving potentially beneficial therapeutic support. The professional reasoning process for similar situations should involve a systematic approach, 1. Active listening and empathy. Understand the client's perspective and their reasons for requesting specific modifications. 2. Comprehensive assessment. Conduct a thorough evaluation of the client's musculoskeletal condition, including range of motion, pain levels, muscle strength, and any relevant medical history. 3. Risk-benefit analysis. Evaluate the potential risks and benefits of the requested modifications in light of the client's assessment. 4. Informed consultation. Clearly communicate findings, potential risks, and alternative strategies to the client, empowering them to make informed decisions. 5. Collaborative planning. Work with the client to develop a safe and effective therapeutic plan that incorporates appropriate modifications and respects their autonomy. 6. Documentation. Maintain detailed records of the assessment, discussions, and the agreed-upon treatment plan. Question 3. Strategic planning requires a nuanced understanding of how the historical context of yoga informs its contemporary therapeutic applications. When preparing for the IAYT certification, which approach to understanding yoga's historical context is most aligned with the professional standards and scope of practice for yoga therapists? Option A. Focusing on the evolution of yoga from ancient philosophical and spiritual traditions into a distinct, evidence-informed therapeutic modality specifically designed to address health and well-being. Option B. Concentrating on the most recent secularized interpretations and popular trends in yoga, viewing them as the primary drivers of its therapeutic potential. Option C. Prioritizing the examination of yoga's diverse global adaptations as a form of physical exercise and general wellness practice, independent of its historical philosophical roots. Option D. Emphasizing the study of ancient Sanskrit texts and philosophical treatises to understand yoga's origins, without necessarily connecting them to modern therapeutic applications. The correct answer is A. Focusing on the evolution of yoga from ancient philosophical and spiritual traditions into a distinct, evidence-informed therapeutic modality specifically designed to address health and well-being. Explanation. This scenario presents a challenge in accurately representing the historical evolution of yoga therapy within the context of IAYT certification. The core difficulty lies in distinguishing between the broad philosophical and spiritual origins of yoga and its more recent, specific application as a therapeutic modality. A IAYT professional must demonstrate an understanding of this distinction to uphold the integrity of the profession and adhere to the standards set by the International Association of Yoga Therapists, IAYT. The correct approach emphasizes the development of yoga as a distinct therapeutic practice, acknowledging its roots while highlighting the specific adaptations and applications that define yoga therapy. This aligns with the IAYT focus on evidence-informed practices and the professionalization of yoga therapy. It demonstrates an understanding of how yoga has been intentionally structured and applied to address specific health conditions, a key component of the certification. An incorrect approach that focuses solely on ancient philosophical texts without acknowledging the evolution into a therapeutic discipline fails to recognize the specific scope of yoga therapy as defined by IAYT. This would be a regulatory failure, as it misrepresents the professional domain, and an ethical failure, as it could lead to misinformed practice or client expectations. Another incorrect approach that conflates yoga therapy with all forms of physical exercise or general wellness practices overlooks the unique philosophical underpinnings and holistic approach inherent in yoga therapy. This would be a regulatory failure by not adhering to the specific definition and scope of yoga therapy, and an ethical failure by diluting the specialized nature of the profession. Finally, an approach that prioritizes modern, secularized interpretations of yoga without acknowledging its historical and philosophical lineage risks presenting an incomplete or distorted picture. While modern adaptations are relevant, comprehensive understanding requires acknowledging the foundational principles from which yoga therapy emerged. This would be an ethical failure by potentially misrepresenting the depth and breadth of the practice, and a regulatory failure by not fully embracing the historical context that informs the therapeutic application. The professional decision-making process should involve critically evaluating historical information through the lens of the IAYT-defined scope of practice. Professionals should ask, does this historical perspective directly inform the principles and practices of yoga therapy as recognized by IAYT? This ensures that the understanding of historical context is relevant, accurate, and supportive of professional competence and ethical practice. Question 4. Consider a scenario where a yoga therapist is working with a client experiencing chronic anxiety. The therapist is contemplating how to best utilize the principles of the 8 limbs of yoga Ashtanga to support this client. Which of the following approaches best reflects a comprehensive and ethically sound application of these principles within a yoga therapy context, as guided by CI8 standards? Option A. Prioritizing the establishment of a safe and trusting therapeutic relationship by focusing on the yamas, ethical restraints, and niyamas, observances, as the foundation, and then integrating appropriate asana, postures, and pranayama, breathwork, to address the client's anxiety symptoms, while also considering elements of meditation and mindfulness. Option B. Focusing exclusively on a series of challenging asana, postures, designed to build physical strength and resilience, believing that physical exertion will naturally alleviate anxiety. Option C. Introducing advanced pranayama, breathwork, techniques immediately to regulate the nervous system, without first establishing a strong ethical framework or assessing the client's readiness for such intense practices. Option D. Recommending extensive study of the philosophical texts of yoga, such as the Yoga Sutras, as the primary intervention, with minimal emphasis on practical application of asana or pranayama. The correct answer is A. Prioritizing the establishment of a safe and trusting therapeutic relationship by focusing on the yamas, ethical restraints, and niyamas, observances, as the foundation, and then integrating appropriate asana, postures, and pranayama, breathwork, to address the client's anxiety symptoms, while also considering elements of meditation and mindfulness. Explanation: this scenario presents a professional challenge because it requires a yoga therapist to integrate the foundational principles of yoga, specifically the 8 limbs of yoga, Ashtanga, into a therapeutic context while adhering to the ethical and professional standards set by the CIA. The core difficulty lies in discerning how to apply these philosophical and ethical guidelines in a practical, client-centered therapeutic setting, ensuring that the application is both effective and aligned with the scope of practice for a yoga therapist. The CI8 framework emphasizes a holistic approach to well-being, and understanding how to translate the 8 limbs into actionable therapeutic interventions is crucial for demonstrating competence and ethical practice. The correct approach represents best professional practice because it demonstrates a deep understanding of the 8 limbs of yoga as a comprehensive framework for personal development and well-being, and its direct relevance to therapeutic support. By focusing on the ethical observances, yamas, and self-disciplines, niyamas, as foundational to the therapeutic relationship, and then considering how postures, asana, and breathwork, pranayama, can be used to address specific client needs, the therapist is acting in accordance with the CI8 emphasis on ethical conduct, client safety, and evidence-informed practice. This approach prioritizes the establishment of trust and respect, essential for any therapeutic alliance, and then strategically employs yogic tools to support the client's journey towards healing and balance, aligning with the holistic principles of yoga therapy. An incorrect approach that focuses solely on physical postures, asana, without considering the ethical and philosophical underpinnings of the 8 limbs, fails to recognize the integrated nature of yoga therapy. This would be a regulatory and ethical failure because it reduces yoga therapy to a purely physical practice, neglecting the profound impact of ethical conduct, mental discipline, and mindful awareness on a client's overall well-being. Such an approach risks overlooking crucial aspects of a client's experience and may not provide comprehensive support, potentially violating the CI8 mandate for a holistic and ethical approach. Another incorrect approach that prioritizes advanced pranayama techniques without establishing a strong foundation in yamas and niyamas would also be a significant ethical and regulatory failure. This approach is problematic because it could lead to the misuse of powerful breathwork techniques without the necessary ethical grounding or client readiness, potentially causing harm or distress. The CI8 expects yoga therapists to apply techniques responsibly and ethically, ensuring that the client's safety and well-being are paramount, which includes building a strong ethical framework before introducing more advanced practices. A professional decision-making process for similar situations should begin with a thorough assessment of the client's needs and goals, always within the ethical guidelines of the CIA. This involves understanding the client's current state of being, their challenges, and their aspirations. Next, the therapist should consider how the 8 limbs of yoga in their entirety can inform the therapeutic plan. This means reflecting on how to foster ethical principles within the therapeutic relationship, how to encourage self-discipline and self-awareness in the client, and how to judiciously select and apply appropriate yogic tools such as asana, pranayama, and meditation, always prioritizing the client's safety, comfort, and progress. The decision-making process should be iterative, allowing for adjustments based on the client's ongoing experience and feedback, ensuring that the therapeutic intervention remains client-centered and ethically sound. Question 5. The investigation demonstrates a yoga therapist working with a client experiencing chronic stress and anxiety. The therapist, deeply familiar with the Yoga Sutras of Patanjali, the Bhagavad Gita, and the Hatha Yoga Pradipika, is considering how to best utilize these texts to support the client's therapeutic journey. Which approach best aligns with the ethical and professional standards for CI8 certification? Option A. Select specific verses or concepts from these texts that directly address the client's symptoms of stress and anxiety, and guide the client in their contemplation and application as part of their personal practice, always ensuring the interpretation is relevant to their current life circumstances and within the scope of yoga therapy. Option B. Recommend specific asanas and pranayama techniques described in the Hatha Yoga Pradipika as the sole therapeutic intervention, without integrating other philosophical or psychological aspects of the text or the client's experience. Option C. Interpret and present philosophical tenets from the texts as definitive spiritual or life guidance, irrespective of the client's personal beliefs or therapeutic goals, to impart wisdom for overcoming stress. Option D. Focus exclusively on modern psychological techniques for stress management, as the ancient texts are too philosophical and not directly applicable to contemporary therapeutic interventions for anxiety. The correct answer is A. Select specific verses or concepts from these texts that directly address the client's symptoms of stress and anxiety, and guide the client in their contemplation and application as part of their personal practice, always ensuring the interpretation is relevant to their current life circumstances and within the scope of yoga therapy. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a yoga therapist to integrate ancient yogic philosophy with modern therapeutic practice, while adhering to the specific ethical and professional standards of the CI8 certification. The challenge lies in discerning how to apply foundational texts like the Yoga Sutras, Bhagavad Gita, and Hatha Yoga Pradipika in a way that is both authentic to yogic tradition and relevant to the client's contemporary health concerns, without overstepping the boundaries of a yoga therapist's scope of practice. The therapist must navigate potential misinterpretations of these texts and ensure their application is client-centered and evidence-informed where applicable within the CI8 framework. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a client-centered, ethical, and scope-appropriate application of yogic philosophy. It involves a thoughtful, nuanced interpretation of the key texts, considering their historical context and philosophical depth, and then carefully translating these principles into actionable therapeutic strategies that align with the client's specific needs and the CI8 ethical guidelines. This approach emphasizes the therapist's role as a facilitator of self-discovery and healing, drawing upon the wisdom of the texts to inform, rather than dictate, the therapeutic process. It respects the client's autonomy and the therapist's professional boundaries, ensuring that the application of these texts enhances, rather than compromises, the therapeutic relationship and outcomes. Incorrect approaches analysis. One incorrect approach involves a rigid, literal interpretation of the texts, applying ancient philosophical concepts directly to modern ailments without considering the client's individual context or the therapeutic relationship. This fails to meet CI8 ethical standards by potentially imposing philosophical dogma, neglecting client-centered care, and misapplying principles outside the scope of yoga therapy. It risks alienating the client and can lead to ineffective or even harmful therapeutic interventions. Another incorrect approach is to dismiss the relevance of these foundational texts entirely, focusing solely on modern therapeutic techniques without acknowledging the rich philosophical underpinnings of yoga therapy. This approach fails to leverage the unique strengths of yoga therapy as a holistic practice, potentially limiting the depth and effectiveness of the therapeutic intervention. It also disregards the core principles that inform the CI8 certification, which inherently values the integration of yogic philosophy into therapeutic practice. A third incorrect approach might involve using the text to provide unsolicited spiritual or philosophical advice that is not directly related to the client's stated therapeutic goals or within the therapist's expertise. This crosses professional boundaries, potentially leading to ethical violations and undermining the client's trust. It also deviates from the CI8 emphasis on evidence-informed and client-centered therapeutic interventions. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's needs and goals. This is followed by a critical evaluation of how principles from the Yoga Sutras, Bhagavad Gita, and Hatha Yoga Pradipika can be thoughtfully and ethically integrated to support those goals. The therapist must constantly refer to the CI8 Code of Ethics and Professional Conduct, ensuring that their application of these texts is client-centered, respectful of autonomy, and within the defined scope of yoga therapy. This involves a continuous process of self-reflection, seeking supervision or consultation when necessary, and prioritizing the client's well-being above all else. Question 6. Upon reviewing a new client's intake form, a yoga therapist notes a detailed description of intermittent tingling and numbness in the extremities, accompanied by reports of occasional muscle weakness and balance disturbances. The client states these symptoms have been present for several months and are impacting their daily activities, but they have not yet consulted a medical doctor. What is the most appropriate course of action for the yoga therapist to take in accordance with CI8 guidelines? Option A. Design a yoga therapy program focused on gentle movement and breathwork to manage stress, which the client reports as a contributing factor. Option B. Advise the client that these symptoms are common manifestations of stress and can be effectively managed with a general yoga practice. Option C. Begin a yoga therapy sequence specifically targeting nerve stimulation and muscle strengthening to address the reported weakness and numbness. Option D. Recommend the client seek immediate medical evaluation from a physician to investigate the neurological symptoms before proceeding with yoga therapy. The correct answer is D. Recommend the client seek immediate medical evaluation from a physician to investigate the neurological symptoms before proceeding with yoga therapy. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a yoga therapist to integrate their understanding of the nervous system's complex interplay with a client's reported symptoms, while strictly adhering to the CI8 scope of practice and ethical guidelines. The challenge lies in discerning when symptoms might indicate a need for referral to a medical professional versus when they fall within the purview of yoga therapy for supportive care. Misinterpreting these signals could lead to delayed medical diagnosis or inappropriate therapeutic interventions, both of which carry significant ethical and professional risks. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the client's safety and well-being through a collaborative, evidence-informed process. It involves a thorough assessment that considers the client's reported symptoms in the context of their overall health, recognizing the potential for overlap between nervous system dysfunction and various medical conditions. By advocating for a medical evaluation to rule out underlying pathology, the yoga therapist acts within their ethical obligations to practice within their scope and to refer when necessary. This aligns with CI8 emphasis on client safety and the importance of interdisciplinary collaboration, ensuring that the client receives appropriate care for all aspects of their health. Incorrect approaches analysis. One incorrect approach involves immediately designing a yoga therapy program to address the reported symptoms without first seeking medical clarification. This fails to acknowledge the potential for serious underlying medical conditions that require diagnosis and treatment by a qualified physician. Ethically, this could be considered practicing outside the scope of yoga therapy and potentially causing harm by delaying necessary medical intervention. It violates the principle of do no harm and the CI8 ethical standard of practicing within one's competence and referring when appropriate. Another incorrect approach is to dismiss the client's symptoms as solely stress-related and to proceed with general relaxation techniques without further investigation. This overlooks the possibility that the reported symptoms, even if exacerbated by stress, may have a distinct physiological origin. It demonstrates a lack of thoroughness in assessment and a failure to consider the full spectrum of potential causes, which is a deviation from best practices in client care and could lead to inadequate support for the client's actual needs. A further incorrect approach is to provide a yoga therapy intervention that directly targets specific neurological functions without a clear understanding of the client's medical diagnosis or a referral from a healthcare provider. This could involve techniques that are contraindicated for certain neurological conditions or that might inadvertently exacerbate symptoms. It represents a significant overreach of the yoga therapist's scope of practice and a potential violation of ethical guidelines regarding competence and client safety. Professional reasoning. Professionals in this situation should employ a decision-making framework that begins with thorough client assessment, including a detailed history of symptoms and their impact. This should be followed by a clear understanding of the yoga therapist's scope of practice as defined by CIAYT. When symptoms suggest potential medical involvement, the paramount step is to encourage and facilitate a consultation with a qualified healthcare professional for diagnosis and treatment. Only after medical clearance or in collaboration with the medical team should a yoga therapy plan be developed, ensuring it complements, rather than replaces, conventional medical care. This iterative process of assessment, referral, and collaborative planning ensures client safety and adherence to professional and ethical standards. Question 7. Market research demonstrates that clients seeking yoga therapy often have specific postures or practices they wish to incorporate into their sessions, sometimes based on personal preference or information from non-therapeutic sources. A client with a history of acute lower back pain and a recent flare-up expresses a strong desire to perform deep spinal twists in their upcoming session, believing it will provide immediate relief. As a CIAYT certified yoga therapist, how should you ethically and professionally address this request? Option A. Gently explain the potential contraindications of deep spinal twists during an acute flare-up of lower back pain. Educate the client on why these movements might exacerbate their condition, and collaboratively propose therapeutic modifications or alternative poses that address their desire for movement and relief in a safe and supportive manner. Option B. Firmly refuse the client's request for deep spinal twists without further explanation, stating that it is not within the scope of therapeutic yoga. Option C. Immediately agree to the client's request to perform deep spinal twists, prioritizing their expressed desire to ensure client satisfaction and avoid potential conflict. Option D. Proceed with the deep spinal twists as requested, but instruct the client to stop immediately if they experience any significant discomfort, assuming they will self-regulate their pain. The correct answer is A. Gently explain the potential contraindications of deep spinal twists during an acute flare-up of lower back pain. Educate the client on why these movements might exacerbate their condition, and collaboratively propose therapeutic modifications or alternative poses that address their desire for movement and relief in a safe and supportive manner. Explanation. This scenario presents a common implementation challenge for yoga therapists, balancing the client's expressed desires with the ethical imperative of ahimsa, particularly when those desires might lead to harm or exacerbate existing conditions. The professional challenge lies in navigating this delicate balance without causing distress or alienating the client, while upholding the core principles of therapeutic yoga. Careful judgment is required to ensure the client's well-being is paramount, even when it conflicts with their immediate requests. The correct approach represents best professional practice because it prioritizes the client's safety and long-term well-being, which is a fundamental ethical and regulatory expectation for CIAYT certified professionals. By gently educating the client about the potential contraindications and offering modified therapeutic alternatives, the therapist upholds ahimsa, non-harming, by preventing potential physical or emotional distress. This aligns with the CIAYT Code of Ethics and Professional Conduct, which mandates that therapists act in the best interest of their clients and avoid causing harm. The therapist's role is to guide the client towards healing and well-being, which may involve setting boundaries and offering evidence-informed recommendations. An incorrect approach that directly fulfills the client's request without considering potential harm would be a significant ethical failure. It violates the principle of ahimsa by potentially leading to physical injury or emotional distress, directly contravening the CIAYT ethical guidelines. Another incorrect approach, such as dismissing the client's request outright without explanation or empathy, could be perceived as a lack of respect and could damage the therapeutic relationship, potentially causing emotional harm and failing to meet the client's needs in a supportive manner. This also undermines the therapeutic alliance, which is crucial for effective practice. A third incorrect approach, focusing solely on the client's perceived immediate benefit without considering the broader therapeutic context or potential long-term consequences, demonstrates a lack of comprehensive understanding of therapeutic yoga and its ethical underpinnings. The professional decision-making process for similar situations involves a multi-step approach. First, actively listen to and acknowledge the client's request and their underlying motivations. Second, assess the request against the principles of therapeutic yoga and the client's known physical and emotional state, considering potential risks and benefits. Third, consult relevant ethical guidelines and professional standards, such as the IAYT Code of Ethics. Fourth, communicate concerns and recommendations to the client in a clear, compassionate, and non-judgmental manner, explaining the rationale behind any proposed modifications or limitations. Fifth, collaboratively explore alternative approaches that honor the client's goals while ensuring safety and promoting well-being. Question 8. Examination of the data shows a client diagnosed with moderate persistent asthma and early-stage COPD seeking yoga therapy to manage their respiratory symptoms and improve their quality of life. The client has a prescribed inhaler regimen and is under the care of a pulmonologist. Which of the following approaches best aligns with the IAYT ethical guidelines and scope of practice for supporting this client? Option A. Recommend that the client discontinue their prescribed medications and rely solely on yoga therapy for managing their asthma and COPD symptoms, as yoga has been shown to be highly effective. Option B. Introduce advanced and potentially challenging pranayama techniques to significantly increase lung capacity and respiratory efficiency, with the expectation that this will reduce the client's reliance on prescribed inhalers. Option C. Design a yoga therapy program focused on vigorous physical postures and breath-holding exercises to build overall physical resilience, assuming this will indirectly benefit their respiratory conditions. Option D. Develop a personalized yoga therapy plan that includes gentle pranayama techniques, mindful movement, and relaxation practices, with a strong emphasis on breath awareness and modifications to accommodate the client's respiratory status, while encouraging continued adherence to their medical treatment and regular consultation with their pulmonologist. The correct answer is D. Develop a personalized yoga therapy plan that includes gentle pranayama techniques, mindful movement, and relaxation practices, with a strong emphasis on breath awareness and modifications to accommodate the client's respiratory status, while encouraging continued adherence to their medical treatment and regular consultation with their pulmonologist. Explanation: this scenario presents a professional challenge due to the inherent complexity of managing respiratory disorders like asthma and COPD within the scope of yoga therapy. The IAYT certification requires practitioners to operate within their defined competencies, respecting the boundaries of medical diagnosis and treatment. A key ethical and regulatory consideration is the yoga therapist's role in supporting individuals with these conditions, which involves understanding contraindications, appropriate modifications, and when to refer to or collaborate with medical professionals. The correct approach represents best professional practice because it prioritizes client safety and well-being by integrating yoga therapy with conventional medical care. This aligns with the IAYT emphasis on ethical conduct, scope of practice, and the importance of interdisciplinary collaboration. Specifically, it acknowledges that yoga therapy is a complementary approach and not a substitute for medical treatment. The yoga therapist's role is to empower the client with self-management tools, enhance their quality of life, and support their overall well-being, always within the framework of their medical management plan. This approach respects the client's autonomy and ensures that their respiratory health is managed holistically and safely. An incorrect approach that focuses solely on advanced pranayama techniques without considering the client's specific respiratory status and medical advice would be a significant regulatory and ethical failure. This could lead to exacerbation of symptoms, potential harm, and a violation of the yoga therapist's duty of care. Similarly, an approach that suggests yoga therapy can cure or replace prescribed medications directly contradicts established medical understanding and the ethical guidelines of the IAYT, potentially leading to serious health consequences for the client. Another incorrect approach might involve neglecting to inquire about the client's current medical treatment and physician's recommendations, thereby failing to ensure that the yoga therapy practice is safe and complementary to their existing care plan. This oversight undermines the principle of informed consent and responsible practice. Professional decision-making in such situations requires a systematic process. First, thoroughly understanding the client's medical condition and current treatment plan through open communication, and when appropriate, consultation with their healthcare providers. Second, assessing the client's individual capacity and any contraindications for specific yoga practices. Third, designing a yoga therapy plan that is safe, supportive, and complementary to their medical care, with clear modifications and an emphasis on breath awareness and gentle movement. Finally, continuously monitoring the client's response and being prepared to adjust the plan or refer them back to their medical team as needed. Question 9. Performance analysis shows a yoga therapist is guiding a client through Trikonasana triangle pose. The client reports a sharp sensation in their right hip during the pose, despite appearing to follow the verbal cues for alignment. The therapist has observed the client's general posture and breath. What is the most appropriate next step for the yoga therapist? Option A. Assume the client is experiencing muscle tightness and instruct them to push through the sensation, suggesting deeper breathing to relax the hip. Option B. Immediately instruct the client to come out of the pose and explore alternative poses that do not engage the hip in a similar manner, while also inquiring further about the nature and onset of the hip sensation. Option C. Proceed with the pose, explaining that some discomfort is normal when stretching and encouraging the client to hold the pose for a longer duration to build resilience. Option D. Ask the client to demonstrate their understanding of the alignment cues again, and then proceed with the pose, assuming a misunderstanding of instructions is the cause of the sensation. The correct answer is B. Immediately instruct the client to come out of the pose and explore alternative poses that do not engage the hip in a similar manner, while also inquiring further about the nature and onset of the hip sensation. Explanation. This scenario presents a common challenge in yoga therapy where a client's reported pain during a specific asana may stem from a variety of factors, including anatomical variations, improper technique, or pre-existing conditions. The IAYT certification framework emphasizes a client-centered, evidence-informed approach that prioritizes safety and efficacy. A yoga therapist must be able to assess the situation holistically, considering the client's subjective experience alongside objective observations, and apply principles of biomechanics and therapeutic application of asana. The correct approach involves a thorough, individualized assessment to understand the root cause of the client's discomfort. This aligns with the IAYT ethical guidelines and professional standards, which mandate that a yoga therapist provide services that are safe, appropriate, and tailored to the individual's needs and limitations. It requires the therapist to utilize their knowledge of asana principles, contraindications, and modifications to ensure the client's well-being and therapeutic progress. This approach is grounded in the principle of do no harm and the commitment to evidence-based practice. An incorrect approach would be to dismiss the client's pain or to apply a generic modification without understanding the underlying issue. This could lead to exacerbating the client's condition, causing further injury, and violating the IAYT ethical obligations to provide competent and individualized care. Failing to investigate the cause of pain demonstrates a lack of due diligence and a disregard for the client's subjective experience, which is paramount in therapeutic settings. Another incorrect approach would be to force the client into the pose, disregarding their pain signals, which is a direct contravention of safety principles and ethical practice. The professional decision-making process in such a situation should involve 1. Active listening and validation of the client's reported experience. 2. A systematic assessment of the asana's execution, including observation of posture, breath, and any compensatory movements. 3. Consideration of potential anatomical factors, contraindications, and the client's medical history. 4. Application of appropriate modifications or alternative poses based on the assessment findings. 5. Clear communication with the client about the rationale for any adjustments and ongoing monitoring of their response. This iterative process ensures that the therapeutic intervention remains safe, effective, and responsive to the client's evolving needs. Question 10. Risk assessment procedures indicate that a client with a chronic autoimmune condition expresses significant distress, stating that their illness feels like a deviation from their life's purpose or dharma, and they are struggling to find meaning in their current health state. The yoga therapist is trained in the philosophical underpinnings of yoga. What is the most appropriate therapeutic approach? Option A. Advise the client that their focus on dharma is a distraction from the physical management of their condition, and encourage them to concentrate solely on the prescribed physical yoga practices for symptom relief. Option B. Explore with the client how their understanding of dharma might inform their perception of their illness, and identify potential pathways within their own belief system to find meaning and resilience, integrating this into the therapeutic plan. Option C. Offer the client a specific interpretation of Dharma as it relates to suffering and illness, guiding them towards a particular spiritual understanding that the therapist believes will be most beneficial. Option D. Suggest that the client seek guidance from a spiritual leader or religious advisor to address their concerns about Dharma, as this falls outside the scope of yoga therapy. The correct answer is B. Explore with the client how their understanding of Dharma might inform their perception of their illness and identify potential pathways within their own belief system to find meaning and resilience, integrating this into the therapeutic plan. Explanation. This scenario presents a professional challenge because it requires the yoga therapist to navigate the intersection of a client's deeply held personal beliefs, which are integral to their sense of purpose and well-being Dharma, with the therapeutic goals of managing a chronic health condition. The challenge lies in respecting the client's spiritual framework without imposing personal beliefs or misinterpreting the therapeutic application of Dharma. Careful judgment is required to ensure that the therapeutic intervention is both ethically sound and effective, aligning with the CI8 ethical guidelines which emphasize client autonomy, respect for diverse beliefs, and the principle of non-maleficence. The correct approach represents best professional practice because it directly addresses the client's expressed need to integrate their understanding of Dharma into their therapeutic journey. By exploring how the client perceives their Dharma and how this relates to their current health challenges, the yoga therapist facilitates a client-centered approach. This respects the client's autonomy and acknowledges the holistic nature of well-being, where spiritual and existential factors are as crucial as physical ones. This aligns with CI8 emphasis on a comprehensive understanding of the individual and the use of yoga's philosophical underpinnings to support healing, provided it is done with sensitivity and without imposing a specific interpretation. An incorrect approach that focuses solely on the physical manifestations of the chronic condition, without acknowledging the client's spiritual framework, fails to provide holistic care. This neglects a significant aspect of the client's lived experience and may lead to a therapeutic disconnect, as the client's sense of purpose and meaning, often tied to Dharma, is a powerful motivator and source of resilience. This approach could be seen as a failure to uphold the ethical principle of beneficence by not fully addressing the client's needs. Another incorrect approach that attempts to define or impose a specific interpretation of the client's Dharma is ethically problematic. Yoga therapists are not spiritual leaders or dogma enforcers. Their role is to facilitate the client's exploration and integration of their own beliefs. Imposing a particular view of Dharma violates client autonomy and could lead to spiritual distress or a breakdown of trust. This would be a direct contravention of CI8 ethical guidelines regarding professional boundaries and respect for client diversity. The professional decision-making process for similar situations should involve active listening to understand the client's perspective, particularly their spiritual and existential concerns. The therapist should then collaboratively explore how these concerns intersect with their health condition and therapeutic goals. This involves asking open-ended questions, validating the client's experiences, and drawing upon the philosophical principles of yoga in a way that supports the client's self-discovery rather than dictating it. The therapist must remain within their scope of practice, focusing on how yoga principles, including Dharma, can be applied therapeutically to enhance well-being, always prioritizing the client's autonomy and the therapeutic alliance. Question 11. Analysis of how the interconnectedness of the musculoskeletal, nervous, and respiratory systems can influence the effectiveness of yoga therapy interventions for a client experiencing chronic low back pain, considering the CI8 scope of practice. Option A. Focusing exclusively on strengthening the abdominal muscles through intense core work without considering the impact on spinal mobility or the client's ability to breathe deeply, as strong abs are the primary solution for back pain. Option B. Recommending a series of advanced back bends and inversions to aggressively decompress the lumbar spine and stimulate circulation, assuming these poses will universally alleviate chronic low back pain. Option C. Suggesting a generic yoga class sequence found online that targets general flexibility, without a specific assessment of the client's low back pain or consideration of how their unique anatomical interactions might be affected. Option D. Designing a yoga practice that incorporates gentle spinal mobilizations, diaphragmatic breathing exercises to promote core stability, and mindful awareness of pelvic alignment to address the interplay between muscle tension, nerve irritation, and inefficient breathing patterns contributing to low back pain. The correct answer is D. Designing a yoga practice that incorporates gentle spinal mobilizations, diaphragmatic breathing exercises to promote core stability, and mindful awareness of pelvic alignment to address the interplay between muscle tension, nerve irritation, and inefficient breathing patterns contributing to low back pain. Explanation: this scenario presents a professional challenge because it requires a yoga therapist to integrate knowledge of anatomical systems and their interrelationships to effectively address a client's specific needs within the scope of practice defined by the IAYT certification. The core of the challenge lies in moving beyond isolated anatomical understanding to a holistic, functional perspective that informs therapeutic interventions. Careful judgment is required to ensure that the proposed yoga practices are safe, appropriate, and directly contribute to the client's therapeutic goals, respecting the boundaries of yoga therapy. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of integrative anatomy and its application to yoga therapy. By considering how the musculoskeletal, nervous, and respiratory systems interact, the therapist can design a sequence that not only targets the client's reported knee pain, but also addresses potential contributing factors and promotes overall functional improvement. This aligns with IAYT ethical guidelines, which emphasize the importance of a thorough client assessment and the development of individualized therapeutic plans based on sound knowledge of anatomy and physiology. The approach prioritizes client safety and efficacy by considering the interconnectedness of bodily systems, preventing potential exacerbation of symptoms by addressing root causes rather than just superficial manifestations. An incorrect approach that focuses solely on strengthening the quadriceps without considering the biomechanics of the hip and ankle would be professionally unacceptable. This failure stems from a lack of integrative anatomical understanding, potentially leading to compensatory movements or increased strain on other joints, violating the ethical principle of do no harm. Another incorrect approach that involves recommending advanced inversions to alleviate knee pain without a clear anatomical rationale linking inversions to knee pathology and without assessing the client's contraindications would be a significant ethical and professional lapse. This demonstrates a disregard for the client's specific condition and the principles of safe, therapeutic yoga practice, potentially causing harm and exceeding the scope of yoga therapy. A third incorrect approach that relies on anecdotal evidence or popular yoga trends without a foundation in anatomical principles would also be unacceptable. This demonstrates a lack of professional competence and a failure to adhere to evidence-informed practice, which is implicitly expected within a certified therapeutic profession. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough assessment of the client's condition, including their reported symptoms, medical history, and functional limitations. Second, apply knowledge of integrative anatomy to understand how different bodily systems interact and contribute to the client's presentation. Third, identify specific anatomical and physiological mechanisms that are likely involved in the client's discomfort or dysfunction. Fourth, design a yoga therapy intervention that directly addresses these identified mechanisms, considering potential contraindications and modifications. Fifth, continuously monitor the client's response to the intervention and adjust the plan as needed, always prioritizing safety and efficacy within the scope of yoga therapy practice as defined by IAYT. Question 12. Process analysis reveals that a yoga therapist is developing a personalized yoga therapy plan for a client experiencing chronic low back pain. The therapist needs to select appropriate poses and modifications that address the client's specific anatomical vulnerabilities while avoiding exacerbation of their condition. Which of the following anatomical considerations is most critical for the therapist to prioritize when designing this plan? Option A. The precise articulation and movement capabilities of the sacroiliac joints and their relationship to pelvic stability. Option B. The vascular supply and innervation of the extremities and their impact on circulation. Option C. The general flexibility of the hamstrings and their effect on spinal flexion. Option D. The superficial musculature of the upper back and shoulders and their influence on postural alignment. The correct answer is A. the precise articulation and movement capabilities of the sacroiliac joints and their relationship to pelvic stability. Explanation. Scenario analysis. A yoga therapist is designing a therapeutic program for a client experiencing chronic low back pain. The challenge lies in accurately assessing the client's anatomical limitations and contraindications to ensure the safety and efficacy of the yoga practices prescribed. Misinterpreting anatomical structures or their functional relationships could lead to exacerbating the client's condition or causing new injuries, which directly impacts the professional standard of care expected of a CIAYT. Correct approach analysis. The correct approach involves a comprehensive understanding of the lumbar spine's anatomy, including the vertebral body's intervertebral discs, facet joints, ligaments, and musculature, e.g. erector spinae multifidus, psoas quadratus lumborum. This knowledge allows the therapist to identify movements and postures that might stress compromised structures, such as excessive spinal flexion or extension, or asymmetrical loading. The CIAYT certification framework emphasizes evidence-based practice and client safety, which necessitates a deep anatomical foundation to tailor yoga therapy interventions effectively and ethically. This approach aligns with the core principles of responsible yoga therapy practice, prioritizing client well-being and adherence to professional scope. Incorrect approaches analysis. One incorrect approach would be to rely solely on general knowledge of yoga poses without specific consideration for the client's low back condition. This fails to meet the professional standard of care by not adequately assessing individual anatomical vulnerabilities. It risks prescribing poses that could aggravate disc issues or strain ligaments, violating the ethical obligation to do no harm and the CIAYT commitment to individualized therapeutic plans. Another incorrect approach would be to focus only on the superficial muscles of the back without understanding the deeper stabilizing muscles and their role in spinal support. This oversight can lead to ineffective interventions that do not address the root causes of low back pain and may even create imbalances. It demonstrates a lack of comprehensive anatomical understanding required for advanced therapeutic application, falling short of the expertise expected from a certified yoga therapist. A third incorrect approach would be to generalize contraindications for low back pain without considering the specific anatomical diagnosis or the client's unique presentation. For example, assuming all forward folds are contraindicated without understanding the nature of the client's disc bulge or herniation would be overly restrictive and potentially limit beneficial therapeutic movement. This rigid application of general rules, rather than nuanced anatomical assessment, is a failure of professional judgment and individualized care. Professional reasoning. Professionals should employ a systematic approach that begins with a thorough client assessment, integrating anatomical knowledge with the client's reported symptoms and medical history. This involves a continuous cycle of assessment, intervention, and reassessment, always prioritizing safety and efficacy. When designing therapeutic programs, therapists must consult and apply their understanding of relevant anatomy and biomechanics to make informed decisions about appropriate poses, modifications, and contraindications, ensuring their practice remains within the scope of yoga therapy and adheres to the ethical guidelines of the CIAYT. Question 13. The evaluation methodology shows a certified yoga therapist is working with a client diagnosed with hypertension and a history of heart disease. The therapist has completed a comprehensive intake and is considering the development of a yoga therapy plan. Which of the following represents the most appropriate and ethically compliant course of action? Option A. Immediately begin a vigorous yoga class designed for general fitness, assuming that any form of physical activity will be beneficial for cardiovascular health. Option B. Develop a personalized yoga therapy plan that incorporates gentle poses, breathwork, and relaxation techniques with specific modifications for cardiovascular conditions, and obtain clearance from the client's physician before commencing sessions. Option C. Focus solely on meditation and mindfulness practices, avoiding any physical postures or breathwork that might potentially elevate heart rate. Option D. Recommend a strict ketogenic diet and a series of advanced pranayama techniques to rapidly lower blood pressure without consulting the client's cardiologist. The correct answer is B. Develop a personalized yoga therapy plan that incorporates gentle poses, breathwork, and relaxation techniques with specific modifications for cardiovascular conditions, and obtain clearance from the client's physician before commencing sessions. Explanation. The evaluation methodology shows that a certified yoga therapist is presented with a client diagnosed with hypertension and a history of heart disease. This scenario is professionally challenging because it requires the therapist to integrate their yoga therapy knowledge with an understanding of complex cardiovascular conditions, ensuring that the proposed yoga practices are safe, effective, and aligned with the client's medical management plan. The therapist must navigate potential contraindications, the client's current symptomology, and the need for collaboration with the client's healthcare providers. The correct approach represents best professional practice because it prioritizes client safety and evidence-informed care, which are foundational principles in yoga therapy certification. Adhering to the IAYT Code of Ethics and Professional Conduct, which emphasizes competence, integrity, and the well-being of the client, is paramount. This approach involves a thorough assessment, understanding the client's specific cardiovascular limitations, and developing a personalized, safe, and supportive yoga therapy plan that complements conventional medical treatment. It also includes establishing clear communication channels with the client's physician to ensure integrated care and to obtain necessary clearances or guidance. This aligns with the IAYT commitment to maintaining professional standards and promoting optimal health outcomes for individuals with health conditions. An incorrect approach that involves implementing a generic yoga program without a comprehensive assessment of the client's cardiovascular status and without consulting their physician would represent a significant regulatory and ethical failure. This would violate the IAYT ethical mandate to practice within one's scope of competence and to avoid causing harm. Failing to consider the specific contraindications or potential risks associated with hypertension and heart disease could lead to adverse events, directly contravening the principle of client well-being. Furthermore, neglecting to collaborate with the client's medical team undermines the integrated approach to healthcare that is expected of certified yoga therapists and could lead to conflicting or detrimental therapeutic recommendations. Another incorrect approach, such as recommending specific dietary changes or herbal supplements for managing hypertension, falls outside the scope of practice for a yoga therapist as defined by the IAYT. This oversteps professional boundaries and could interfere with the client's prescribed medical treatment, posing a risk to their health and violating ethical guidelines regarding professional competence and scope of practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough client assessment. This includes understanding the specific diagnosis, current symptoms, medication, and any physician's recommendations or restrictions. 2. Scope of practice adherence. Recognizing the boundaries of yoga therapy and avoiding interventions that fall under the purview of other healthcare professionals. 3. Collaboration with healthcare providers. Seeking necessary clearances, information, and guidance from the client's physician to ensure a coordinated and safe care plan. 4. Personalized program development. Creating a yoga therapy plan that is tailored to the client's individual needs, limitations, and goals, with a strong emphasis on safety and gradual progression. 5. Ongoing monitoring and adaptation. Regularly assessing the client's response to the yoga therapy and making necessary adjustments in consultation with the client and their medical team. Question 14. Research into the therapeutic approaches for autoimmune disorders within the scope of yoga therapy certification, IAYT, requires a yoga therapist to conduct a thorough risk assessment. Which of the following best describes the essential components of this risk assessment process when working with a client diagnosed with an autoimmune condition? Option A. Recommending specific dietary changes and herbal supplements alongside yoga poses to address the underlying autoimmune mechanisms without consulting the client's physician. Option B. A comprehensive evaluation of the client's specific autoimmune diagnosis, current disease activity, conventional medical treatments, and potential contraindications for yoga practice, coupled with a plan for collaborative communication with their healthcare providers. Option C. Providing a standardized sequence of yoga postures designed for general inflammation reduction, without inquiring about the client's specific symptoms or medical history. Option D. Implementing a general yoga class structure that focuses on stress reduction techniques, assuming all autoimmune conditions will respond similarly to basic relaxation practices. The correct answer is B. A comprehensive evaluation of the client's specific autoimmune diagnosis, current disease activity, conventional medical treatments, and potential contraindications for yoga practice, coupled with a plan for collaborative communication with their healthcare providers. Explanation. This scenario presents a professional challenge due to the inherent complexity and variability of autoimmune disorders, coupled with the ethical imperative to provide safe and effective yoga therapy. A CI8 yoga therapist must navigate the delicate balance between offering supportive practices and avoiding interventions that could exacerbate symptoms or interfere with conventional medical treatment. The risk assessment here involves understanding the potential impact of yoga therapy on an individual's specific autoimmune condition, their current disease activity, and their overall health status. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and collaborative strategy. This involves a thorough risk assessment that includes gathering detailed client history, understanding the specific autoimmune condition and its manifestations, and assessing the client's current medical management. Crucially, it necessitates open communication and collaboration with the client's healthcare providers to ensure that yoga therapy complements, rather than conflicts with, their medical care. This aligns with the CI8 Code of Ethics and Professional Conduct, which emphasizes client safety, informed consent, and the importance of working within the scope of practice, recognizing the limitations of yoga therapy and the necessity of interdisciplinary collaboration for complex health conditions. An incorrect approach that involves implementing a standardized, one-size-fits-all yoga protocol for all individuals with autoimmune disorders fails to acknowledge the unique nature of each condition and each client's experience. This is a significant regulatory and ethical failure, as it disregards the principle of individualized care, potentially leading to adverse outcomes. Another incorrect approach, such as recommending yoga therapy as a sole treatment for an autoimmune disorder, is a critical ethical and regulatory breach. This oversteps the scope of practice for a yoga therapist, potentially delaying or undermining essential medical interventions and violating the CI8 commitment to not providing medical advice or treatment. A third incorrect approach, avoiding any discussion of the autoimmune disorder and focusing solely on general relaxation, is also professionally deficient. While relaxation is beneficial, ignoring the specific condition and its implications for practice misses crucial opportunities for safe and targeted therapeutic application, and fails to engage in the necessary risk assessment and collaborative care. Professional decision-making in such situations requires a systematic process. 1. Thoroughly assess the client's condition and history, including their specific autoimmune diagnosis, symptoms, and current medical treatments. 2. Prioritize client safety by identifying potential contraindications and risks associated with yoga therapy for their condition. 3. Obtain informed consent, clearly outlining the scope of yoga therapy and its role in their overall wellness plan. 4. Collaborate with the client's healthcare team, seeking their input and ensuring alignment of therapeutic goals. 5. Develop an individualized yoga therapy plan that is responsive to the client's needs and adapts to changes in their condition. 6. Continuously monitor the client's response to practice and adjust the plan as necessary, maintaining open communication. Question 15. Governance review demonstrates that a new client presents with a diagnosis of stage 2 hypertension, for which they are currently prescribed medication. The client is seeking yoga therapy to help manage stress and improve their overall sense of well-being. What is the most appropriate initial approach for the yoga therapist? Option A. Decline to offer yoga therapy services due to the presence of a diagnosed medical condition, recommending the client seek alternative stress management techniques. Option B. Conduct a thorough assessment of the client's hypertension, including its severity, current management, and any associated complications, to inform a safe and individualized yoga therapy plan with appropriate modifications. Option C. Focus exclusively on gentle breathing exercises and meditation, as these are the only yoga practices considered safe for individuals with hypertension. Option D. Proceed with a standard yoga class designed for general well-being, assuming the client will self-regulate their participation. Correct answer is B. Conduct a thorough assessment of the client's hypertension, including its severity, current management, and any associated complications, to inform a safe and individualized yoga therapy plan with appropriate modifications. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the yoga therapist to navigate the complexities of a client's pre-existing medical condition within the scope of their practice, ensuring client safety and efficacy of the yoga therapy intervention. The challenge lies in balancing the potential benefits of yoga therapy with the risks associated with the client's specific health status, necessitating a thorough understanding of the condition's implications and appropriate modifications. Correct approach analysis. The correct approach involves a comprehensive assessment of the client's hypertension, including understanding its severity, current management, and any associated complications. This assessment informs the development of a safe and individualized yoga therapy plan that incorporates appropriate modifications, contraindications, and considerations for exertion levels. This aligns with the CI8 ethical guidelines and scope of practice, which mandate client safety, informed consent, and the provision of evidence-informed yoga therapy. It emphasizes the therapist's responsibility to work within their competence and to collaborate with the client's healthcare providers when necessary. Incorrect approach is analysis. An approach that immediately dismisses yoga therapy due to the hypertension diagnosis fails to acknowledge the potential benefits yoga therapy can offer for managing stress and improving overall well-being, which can be supportive for individuals with hypertension. This approach may be overly cautious and not aligned with a client-centered, individualized care model. An approach that proceeds with a generic yoga class without any specific modifications or considerations for hypertension overlooks the critical need for individualized care. This could lead to inappropriate poses, excessive exertion, or disregard for potential contraindications, posing a significant risk to the client's health and violating the ethical imperative to provide safe and effective interventions. An approach that focuses solely on relaxation techniques without considering the broader implications of hypertension and the potential for other yoga practices to be beneficial, when appropriately modified, represents an incomplete assessment and intervention. While relaxation is important, a comprehensive plan should address the client's overall needs and goals within the context of their medical condition. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough client assessment, including a detailed understanding of their medical history and current condition. This is followed by a risk-benefit analysis for proposed interventions, consultation with healthcare providers when indicated, and the development of an individualized, evidence-informed plan. Continuous monitoring of the client's response and willingness to adapt the plan based on new information or changes in the client's condition are crucial. Adherence to professional scope of practice and ethical guidelines is paramount throughout the process. Question 16. Cost-benefit analysis shows that implementing a standardized, evidence-based screening tool for common mental health issues at the initial client intake is a valuable investment for yoga therapists, but it presents practical challenges. Considering the CI8 certification requirements and ethical guidelines, which of the following represents the most appropriate and professionally responsible approach for a yoga therapist when screening for mental health issues? Option A. Integrate a brief, validated mental health screening questionnaire into the initial client intake process and establish a clear protocol for reviewing responses, discussing findings with the client, and making appropriate referrals to mental health professionals when indicated, while maintaining the yoga therapy scope of practice. Option B. Skip formal mental health screening altogether to save time and focus exclusively on the physical aspects of yoga therapy, as mental health is outside the purview of yoga therapy. Option C. Rely solely on informal observations during the initial session to gauge a client's mental well-being, assuming that any significant issues will become apparent through the yoga therapy process itself. Option D. Attempt to diagnose and provide therapeutic interventions for identified mental health concerns using yoga therapy techniques, believing that yoga can address all psychological distress. The correct answer is A. Integrate a brief, validated mental health screening questionnaire into the initial client intake process and establish a clear protocol for reviewing responses, discussing findings with the client, and making appropriate referrals to mental health professionals when indicated, while maintaining the yoga therapy scope of practice. Explanation. This scenario presents a common implementation challenge for yoga therapists, balancing the ethical imperative to screen for mental health issues with the practical limitations of time, resources, and the scope of practice. The CI8 certification framework emphasizes the importance of client safety and appropriate referrals, which necessitates a proactive approach to identifying potential mental health concerns that might impact a client's yoga therapy experience or require specialized care. The challenge lies in integrating this screening effectively without overstepping professional boundaries or creating undue burden on the client. The correct approach represents best professional practice because it prioritizes client well-being and adheres to the CI8 ethical guidelines regarding scope of practice and referrals. By utilizing a validated screening tool and having a clear protocol for follow-up, the yoga therapist demonstrates due diligence in identifying potential issues. This approach ensures that clients receive appropriate support, whether that involves modifying the yoga therapy plan, recommending further assessment by a mental health professional, or collaborating with other healthcare providers. This aligns with the CI8 commitment to evidence-informed practice and client-centered care. An incorrect approach that relies solely on informal observation fails to meet the standard of care expected of a certified yoga therapist. While observation is a component of assessment, it is subjective and may miss subtle but significant indicators of mental health conditions. This approach risks a regulatory or ethical failure by not adequately screening for issues that could impact client safety or therapeutic outcomes, potentially leading to harm or delayed appropriate care. Another incorrect approach that involves attempting to diagnose or treat mental health conditions without appropriate qualifications is a clear violation of the CI8 scope of practice. This constitutes a significant ethical and potentially legal failure, as it exceeds the therapist's training and licensure, if applicable. Such actions can lead to misdiagnosis, ineffective treatment, and harm to the client, and would be viewed unfavorably by regulatory bodies. A third incorrect approach that dismisses the need for screening due to perceived time constraints or a belief that yoga therapy is universally beneficial overlooks the potential for contraindications and the importance of a comprehensive client assessment. This can lead to a failure to identify clients who may require specialized mental health support, thereby compromising client safety and the effectiveness of the yoga therapy intervention. It represents a lapse in professional judgment and adherence to ethical standards that mandate a thorough assessment process. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the ethical and regulatory requirements related to client assessment and screening for mental health issues within the CI8 framework. 2. Evaluate available screening tools for their validity, reliability, and appropriateness for the yoga therapy context. 3. Develop a clear protocol for administering screenings, interpreting results, and implementing follow-up actions, including referral pathways. 4. Consider the practicalities of implementation, such as time, resources, and client comfort, while ensuring that ethical obligations are met. 5. Continuously seek professional development to stay informed about best practices in mental health screening and collaboration. Question 17. Which approach would be most appropriate for a CI8 certified yoga therapist when a client presents with persistent fatigue and significant mood fluctuations, reporting that their doctor suspects a potential hormonal imbalance? Option A. Advise the client that their symptoms are likely stress-related and focus exclusively on general relaxation techniques without suggesting a medical referral. Option B. Provide the client with detailed educational materials on the endocrine system and specific yoga poses believed to directly influence hormone production without requiring a medical diagnosis. Option C. Encourage the client to seek a medical evaluation for diagnosis and management of potential hormonal imbalances, while offering supportive yoga practices focused on stress reduction and emotional well-being within the scope of yoga therapy. Option D. Directly recommend dietary changes and specific herbal supplements that are anecdotally known to support hormonal balance, bypassing the need for medical consultation. Correct answer is C. Encourage the client to seek a medical evaluation for diagnosis and management of potential hormonal imbalances, while offering supportive yoga practices focused on stress reduction and emotional well-being within the scope of yoga therapy. Explanation. Scenario analysis. A yoga therapist is working with a client experiencing significant fatigue and mood disturbances, suspected to be related to hormonal imbalances. The challenge lies in differentiating between the scope of practice for a yoga therapist and that of a medical professional, particularly when dealing with complex physiological systems like the endocrine system. It is crucial to avoid making diagnoses or prescribing treatments that fall outside the yoga therapist's certification and ethical guidelines, while still providing supportive and appropriate yoga therapy interventions. Correct approach analysis. The most appropriate approach involves a collaborative and referral-based strategy. This aligns with the CI8 ethical standards and scope of practice, which emphasize working within one's competence and referring to other healthcare professionals when necessary. By encouraging the client to seek a medical evaluation, the yoga therapist ensures that the underlying hormonal issues are properly diagnosed and managed by qualified medical practitioners. Simultaneously, the yoga therapist can offer supportive, non-medical yoga practices that address stress reduction, emotional well-being, and physical comfort, all of which can positively impact the client's experience of hormonal imbalances without overstepping professional boundaries. This approach prioritizes client safety and well-being by integrating yoga therapy with conventional medical care. Incorrect approaches analysis. One incorrect approach would be to directly recommend specific yoga poses or breathing techniques believed to directly balance hormones without a medical diagnosis. This constitutes practicing outside the scope of yoga therapy, as it implies a diagnostic or prescriptive capability for a medical condition. It fails to acknowledge the complexity of hormonal systems and the potential need for medical intervention, thereby posing a risk to the client's health and violating ethical guidelines that prohibit making unsubstantiated claims or providing medical advice. Another incorrect approach would be to dismiss the client's symptoms as purely psychological and focus solely on general relaxation techniques, without acknowledging the potential physiological basis of their complaints. This approach neglects the client's stated concerns and the possibility of a significant medical issue. It fails to uphold the principle of holistic care by not considering all aspects of the client's well-being and could lead to a delay in appropriate medical diagnosis and treatment, which is an ethical failure. A third incorrect approach would be to provide detailed information about specific hormones and their functions in relation to the client's symptoms, implying a level of medical expertise that a yoga therapist does not possess. While education is part of yoga therapy, delving into complex endocrinology without a medical diagnosis or referral can be misconstrued as medical advice or diagnosis, which is outside the CI8 scope of practice and could lead to client confusion or anxiety. Professional reasoning. When faced with a client presenting with symptoms potentially related to the endocrine system, a yoga therapist must first assess their own scope of practice and competence. The primary ethical and professional responsibility is to ensure client safety. This involves recognizing the limits of yoga therapy and the necessity of medical expertise for diagnosis and treatment of physiological conditions. A tiered approach to decision-making is recommended. 1. Acknowledge and validate the client's experience. 2. Assess if the symptoms fall within the scope of yoga therapy or require medical attention. 3. If medical attention is indicated, strongly encourage and facilitate referral to a qualified healthcare provider. 4. If appropriate and within scope, offer supportive yoga therapy interventions that complement medical care and address the client's overall well-being, focusing on stress management, emotional regulation, and gentle movement. Question 18. The review process indicates a candidate's proposed approach to supporting a client experiencing chronic constipation, considering the CI8 scope of practice and the need for a nuanced understanding of the digestive system. Which of the following best reflects a therapeutically sound and ethically compliant strategy? Option A. Recommending a series of gentle abdominal twists and forward folds, coupled with mindful breathing exercises, while emphasizing the importance of hydration and dietary fiber, and advising the client to consult their physician for persistent symptoms. Option B. Prescribing specific pranayama techniques known to stimulate peristalsis, along with a strict regimen of inversions to improve blood flow to the digestive organs, without mentioning medical consultation. Option C. Suggesting that a daily practice of vigorous abdominal strengthening poses will directly resolve the constipation by improving gut motility, and that no further medical advice is needed. Option D. Focusing exclusively on stress reduction through guided imagery, asserting that all digestive issues are psychosomatic and can be fully addressed through mental relaxation alone. The correct answer is A. Recommending a series of gentle abdominal twists and forward folds, coupled with mindful breathing exercises, while emphasizing the importance of hydration and dietary fiber, and advising the client to consult their physician for persistent symptoms. Explanation. The review process indicates a need to assess a CI8 candidate's understanding of the digestive system's anatomy and function within the scope of yoga therapy practice. This scenario is professionally challenging because a yoga therapist must integrate knowledge of physiological systems with yogic principles and practices to provide safe and effective therapeutic interventions. Misunderstanding the digestive system can lead to inappropriate recommendations, potentially exacerbating existing conditions or creating new ones. Careful judgment is required to differentiate between general wellness advice and therapeutic interventions that directly address physiological function. The correct approach represents best professional practice because it demonstrates an understanding of the interconnectedness of the digestive system and the potential impact of yogic techniques. It aligns with the CI8 ethical guidelines and scope of practice, which emphasize evidence-informed practice and client safety. Specifically, it acknowledges that while yoga can support digestive health, it is not a substitute for medical diagnosis or treatment, and that interventions must be tailored to individual needs and contraindications, respecting the boundaries of yoga therapy. An incorrect approach that focuses solely on general relaxation techniques without considering the specific anatomical and functional aspects of the digestive system fails to leverage the therapeutic potential of yoga for this system. This is a regulatory failure, as it neglects the core competency of understanding the body systems relevant to therapeutic application. Another incorrect approach that suggests specific asanas to cure digestive disorders without understanding contraindications or the underlying pathology represents a significant ethical and regulatory failure. This oversteps the scope of yoga therapy, potentially causing harm and violating the principle of do no harm. A third incorrect approach that relies on anecdotal evidence or unverified claims about digestive health through yoga ignores the evidence-informed practice expected of CI8 professionals, leading to a failure in upholding professional standards and potentially misleading clients. Professional decision-making in similar situations requires a systematic approach. First, accurately assess the client's condition and understand the relevant anatomy and physiology of the affected system. Second, consult established yogic texts and contemporary research to identify appropriate yogic tools, asana, pranayama, meditation, etc., that are safe and potentially beneficial for the specific digestive issue. Third, consider individual client factors, including contraindications, severity of the condition, and other medical treatments. Finally, always maintain professional boundaries, referring to medical professionals when necessary and avoiding claims of cure or diagnosis. Question 19. The analysis reveals that a client diagnosed with severe depression and PTSD, who has been attending yoga therapy sessions for general stress reduction, begins to express increased suicidal ideation and a worsening of their depressive symptoms, despite consistent yoga practice. The client's psychiatrist has recently adjusted their medication. As a CI8, what is the most appropriate course of action? Option A. Immediately refer the client to their psychiatrist for an urgent assessment and inform the psychiatrist of the observed changes in the client's mental state, while continuing to offer supportive, gentle yoga practices that do not exacerbate symptoms, pending further guidance. Option B. Advise the client to increase their yoga practice frequency and intensity, believing that yoga alone can overcome these severe symptoms, and suggest they discontinue psychiatric medication if they feel it is not helping. Option C. Continue with the established yoga therapy plan, focusing solely on relaxation techniques, and encourage the client to think positively, without engaging with their psychiatrist or acknowledging the severity of their expressed ideation. Option D. Terminate yoga therapy services immediately without explanation, as the client's condition is beyond the scope of yoga therapy, leaving the client to manage their mental health crisis independently. The correct answer is A. Immediately refer the client to their psychiatrist for an urgent assessment and inform the psychiatrist of the observed changes in the client's mental state, while continuing to offer supportive, gentle yoga practices that do not exacerbate symptoms, pending further guidance. Explanation. This scenario presents a common challenge for yoga therapists, navigating the complexities of mental health conditions within the scope of practice as defined by the International Association of Yoga Therapists, IAYT, standards. The core challenge lies in balancing the therapeutic benefits of yoga with the need for appropriate professional boundaries and referrals when a client's condition may exceed the yoga therapist's expertise or require medical intervention. The correct approach represents best professional practice because it prioritizes client safety and well-being by recognizing the limitations of yoga therapy alone for severe mental health conditions. It aligns with IAYT ethical guidelines, which emphasize the importance of understanding the scope of practice, recognizing when a client's needs extend beyond yoga therapy, and collaborating with other healthcare professionals. This approach ensures that the client receives comprehensive care, potentially involving medical or psychological treatment, while still benefiting from yoga therapy as a complementary modality. An incorrect approach that involves solely focusing on yoga techniques without acknowledging the severity of the depression and anxiety, or without consulting with the client's psychiatrist, would be a significant ethical and regulatory failure. This could lead to a delay in appropriate medical treatment, potentially exacerbating the client's condition, and would violate the IAYT principles of responsible practice and client welfare. Another incorrect approach, such as discontinuing yoga therapy abruptly without a clear transition plan or referral, could also be detrimental, leaving the client without support and potentially increasing feelings of abandonment. This fails to uphold the duty of care expected of a yoga therapist. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's condition, including understanding their existing medical diagnoses and treatment plans. This involves active listening, open communication with the client, and a clear understanding of the yoga therapist's scope of practice as outlined by IAYT. When a client presents with significant mental health challenges, the professional must consider whether their expertise is sufficient and whether collaboration with other healthcare providers is necessary. This often involves seeking consultation, making appropriate referrals, and developing a collaborative care plan that respects the roles of all involved professionals. Question 20. The efficiency study reveals that some yoga therapists are focusing solely on the most recent research regarding the physiological effects of specific yoga postures, potentially overlooking the broader philosophical and ethical frameworks that have historically shaped yoga's therapeutic intent. Which approach best balances the need for evidence-based practice with a respectful understanding of yoga's historical context? Option A. Focusing exclusively on the spiritual and philosophical aspects of yoga, assuming that these inherently translate to therapeutic outcomes without empirical validation. Option B. Adopting ancient yogic texts and practices verbatim without considering modern scientific evidence or contemporary client needs. Option C. Integrating current scientific findings on yoga's efficacy with an awareness of its historical philosophical underpinnings to inform a holistic therapeutic approach. Option D. Prioritizing only the most recent peer-reviewed studies on yoga's physical benefits, as these represent the most advanced understanding of its therapeutic potential. The correct answer is C. Integrating current scientific findings on yoga's efficacy with an awareness of its historical philosophical underpinnings to inform a holistic therapeutic approach. Explanation. The efficiency study reveals a potential disconnect between the historical context of yoga and its modern therapeutic application, posing a professional challenge for CIAYT-certified yoga therapists. This challenge lies in ensuring that therapeutic interventions are not only evidence-based in their current efficacy, but also grounded in a respectful and accurate understanding of yoga's origins, avoiding misrepresentation or appropriation. Careful judgment is required to integrate historical knowledge without imposing outdated or irrelevant practices onto contemporary clients. The correct approach represents best professional practice because it acknowledges the evolution of yoga while maintaining an ethical commitment to its roots. By understanding the historical context, a CIAYT therapist can better discern the core principles and intentions of yoga, informing their therapeutic application with depth and authenticity. This aligns with the CIAYT ethical guidelines, which implicitly encourage a comprehensive and informed approach to yoga therapy, respecting its lineage and diverse philosophical underpinnings. It fosters a more nuanced and client-centered practice, recognizing that the therapeutic benefits of yoga are often intertwined with its philosophical and spiritual dimensions, which have historical roots. An incorrect approach that prioritizes only the most recent scientific studies without considering historical context risks decontextualizing yoga therapy, potentially reducing it to a mere set of physical exercises or relaxation techniques. This failure to acknowledge the philosophical and ethical frameworks that have guided yoga for millennia can lead to superficial interventions that miss deeper therapeutic potential. Ethically, it can be seen as a form of cultural dilution or appropriation, where the essence of a practice is stripped away for a purely utilitarian purpose, disregarding its rich heritage. Another incorrect approach might involve an overly rigid adherence to ancient texts or practices without adapting them to modern therapeutic needs or scientific understanding. This can lead to ineffective or even harmful interventions, as it fails to account for contemporary health conditions, client populations, and the ethical imperative to provide safe and evidence-informed care. It also overlooks the dynamic nature of yoga, which has always adapted and evolved. The professional decision-making process for similar situations involves a continuous cycle of learning and critical evaluation. Professionals should 1. Seek to understand the historical development and philosophical underpinnings of the yoga practices they employ. 2. Critically assess how this historical context informs or influences current therapeutic applications, considering both benefits and limitations. 3. Integrate current scientific research and evidence-based practices with a nuanced understanding of yoga's lineage. 4. Prioritize client well-being and safety, ensuring that all interventions are appropriate, ethical, and culturally sensitive. 5. Engage in ongoing professional development to deepen their knowledge of both historical and contemporary aspects of yoga therapy.